A new study shows vaping can impact blood vessel function after just one use. Pediatrician Dr. Jamie Friedman is here to explain those risks. Doctor, good morning.
Good morning.
We kind of knew when this started that eventually, once all the studies and all the research gets underway, we're going to find a lot of these problems. What does this study now say?
So the study you're referring to is looking at people who were vaping substances, and I don't know what they were, without nicotine, which is very interesting because we know that cigarette smoking causes cardiac disease and blood vessel disease. And now we're seeing that there's potential damage to blood vessels when you're vaping, even without nicotine in it. So it's very concerning.
So when something impacts your blood vessel function upon the first use, for your physical, for your health and everything, what does that mean long term? If it can do that just on the first use?
Well, in this study, it was reversible. So we don't know what happens over long term. There's not a lot of good data on the effects of vaping overall, whether it's on the blood vessels or the lungs, we just don't know. And so it's concerning because with smoking, we know there's a higher risk of stroke and heart attack and things where when your blood vessels are affected and blood doesn't get to parts of your body, it's a problem.
It sure is.
Yeah.
Does the study say anything else about just the overall dangers of vaping, or does it just pick one specific issue?
Not this one specific study, but there have been a lot of reports, as you've known, of lung damage in kids who've been vaping. And again, we don't know what the specific substance is that's causing this lung damage, but it's sending kids to the hospital and even into the ICU.
Wow. Any other risks involved that people need to know about, maybe? Because I think at the beginning when this started, it's like, well, you don't want to smoke. Smoking's bad for you. This is harmless.
Right. There's a very large population of people, adults, who are very pro-vaping because it gets them off cigarette smoking.
Right.
The problem for teens is that there's so much nicotine that it's very addictive. It affects their brains. In studies, it shows that it can lead to cigarette smoking. Even kids who have vaped have higher rates of marijuana smoking. So there are a lot of risks with teens picking up vaping.
The FDA has gotten involved, and they've banned it from most schools, I would assume at this point, because kids were bringing the smaller vaping pens or whatever you want to call them to the classroom and to the recess and everything else.
Right, they make these tiny little vapes that look like little USB ports. I mean, they're very small, not detected. Most schools have banned them. I mean, kids have been suspended for having them. So they're very small, you can hide them very easily, and they're highly marketed to kids because they have these fruity flavors that the FDA has now stepped in and gotten rid of. But, then you have these kids who are already addicted.
It sounds like the commercials when I was growing up where they're targeting young people, the cigarette companies, and now it seems like this is happening all over again. There was a big protest yesterday in New York in front of Juul's headquarters, which is one of the makers of these things. The parents were out there. They brought their kids. They protested. Now that parents are involved, I think people, this is video of that protest from yesterday, Parents Against Vaping. And is this kind of where we're headed eventually, just to ban this, or what's the goal here?
I mean, kids always get the short end of the stick. With everything, they're never really studied. So no one really thought about the unintended consequences where vaping might be good for smokers to quit. It's not good for teens. And now it's something where parents and schools have to step in. And it's one of those things that I now talk about in a visit. We have to talk about vaping. You cannot start vaping. Yeah, you cannot even hold it. You'll get suspended from school.
And a couple years ago, you didn't even mention this.
Right. Times have changed.
The signs that your teenager is vaping. I mean, it's tough for parents to find everything your kids are doing and how you're going to keep up. But what are some of the signs to look for?
Yeah, it's so hard. You have to balance giving them their privacy and their independence, but also really needing to know what's going on. You always want to know where they are, and that can, if they're having a cough that you can't explain. They seem very thirsty, maybe a little jittery. Any change in behavior can be a sign of any substance use or change in their mood. And so parents really want to be on top of all of those things.
Yeah, we also have like unusual items in a sweet smell, like on their person type of sweet smell?
Yeah, but I think a lot of the sweeter, a lot of, vape substances are flavored, but a lot of those flavored substances are starting to take off the market because those were marketed specifically to teens. So to kind of reduce that desire, they're taking away, hopefully, a lot of the sweeter vape substances.
Yeah, it's like you go through this list, and it's like all the older commercial from decades ago. Are your kids on drugs? Are your kids drinking alcohol? It's all this stuff here. It's like even nosebleeds and less need for caffeine also is a sign.
Well, because the nicotine is going to make them feel kind of jittery. Although hopefully kids aren't getting a lot of caffeine anyway. But if they are skipping their morning coffee, maybe ask them, maybe investigate if they've been vaping.
This is fascinating. The fact that it's now something you have to say, in the
I agree.
in the rooms when you're seeing patients. It's unbelievable. Dr. Jamie Friedman, thank you so much.
Thank you.
Very enlightening.